related to COVID in Chicago. We are making excellent progress as a city. We are now averaging fewer than 600 new cases per day. Our rolling average is at 577 new cases per day. That's comparable to where we were 4 months ago, October 13. You might recall we want to get down to below 400 new cases per day, but given that we were seeing more than 3,000 a day at the peak of the second surge, we're making really, really good progress here. So thank you for everybody who has continued to wear your mask, do your social distancing, not take unnecessary COVID risks. Similarly, our percent positivity continues to head the right direction. We are now at 5.6% test positivity across the city. That, again, is comparable to October 12th, the lowest that we've been in about 4 months, and continuing to head the right direction. As a reminder, we'd like to get below 5% positivity and heading better in that direction every single day. Thirdly, our deaths continue to decline in Chicago. We are now averaging below 10 deaths per day. We're at an average of 9 per day. That's comparable to where we were in early November, down more than 50% from our peak in this second surge here. So all of our COVID indicators continue to trend in the right direction, even with some of the limited reopening that we've been able to do over these last few weeks. Now let's talk some vaccine update. We are doing a lot of vaccinating across the U.S. and here in Chicago. There have now been more than 32 million doses of COVID vaccine administered across the country, the most of any country in the world. And we are averaging more than 1 million doses per day right now across the U.S. You can see there's been more than 17 million of the Pfizer vaccine, nearly 15 million of the Moderna vaccine. We continue to have data showing that this is a safe vaccine that is effective against COVID. So I encourage everyone to get the vaccine when it is your turn and to continue to educate yourself and get your questions answered. chi.gov/COVIDVAX, COVID-VAX is where you can go. We're updating it every day with more information about safety, the science behind the vaccine, and our rollout here in Chicago. Here in Chicago, we've administered more than 238,000 doses of COVID vaccine, and 1 in 18 Chicago residents, 5.7%, have now received at least a first dose. You see on this graph here, the blue represents our first doses and the green represents our second doses. As a reminder, everybody needs to get 2 doses of vaccine, no matter whether you've gotten Pfizer or Moderna. The Pfizer second dose comes 3 weeks later. The Moderna second dose comes 4 weeks later. We want you to get that second dose at the same location where you got the first dose. And CDPH has been working hard behind the scenes to make sure that that second dose availability is there. 1 in 18 Chicago residents of all ages have now received at least the first dose of COVID vaccine. Where we only look at Chicagoans 18 plus, which of course are the group that are broadly eligible for the COVID vaccine, that's 1 in 14 Chicago residents. But I'm really pleased to say that 1 week into phase 1B, we're now up to 1 in 8 Chicago residents age 65 plus who have received the COVID vaccine. And other good news, we've worked really hard here in Chicago to ensure that there is not allocated vaccine sitting on the shelf at the federal level, sitting in our warehouses here. We've set a goal of pushing at least 95% of our allocated doses out to providers every week, and we currently are at 99% of our doses pushed out. So we're very pleased about that. Secondly, where we look at vaccine that has been administered. At this point, 78% of our vaccine doses have been administered and reported into the system within 7 days of delivery. That doesn't include the doses that have been held for and administered by the long-term care facility program, which is a program we had to set aside more than 100,000 doses that's rolling out over about 3 months. Putting those aside, 78% of our doses are going into arms and being reported within 7 days. It's not quite where we want to be. Ideally, we'd be at 100% here, and our initial goal is 85%. But it's progress, and we've been really pleased, particularly as we've expanded to hundreds of providers now across Chicago that are able to administer vaccine. As they come on board, they get their systems going, we get their computers hooked up behind the scenes. We do expect to see this number continue to improve, and overall, I'm pleased with where we are. Little more detail, just over this last week, as we opened 1B, as expected, we saw big gains among Chicagoans 65 plus. So just over that week, we saw more than a 5% increase in people in their 60s, more than a 9% increase in people in their 70s and in their 80s. And this is exactly what we expected. As a reminder, most of these people are getting their vaccine because their healthcare provider is calling them. We've pushed vaccine to hospitals, to clinics, to federally qualified health centers, and asked them to call their highest risk existing patients. So all over this city, thousands and thousands of our most vulnerable Chicagoans have been called in for vaccine, and that continues to be really the primary way that many people are being vaccinated and will continue to be vaccinated. We now have more than 400 providers enrolled. Really, the limitation is about the amount of vaccine available. This just shows, as we moved into 1B, we'll post all of these online. The pink represents people in their 70s, the blue represents people in their 80s. You can see this is just our older Chicagoans. As we moved into 1B, really nice increases there. And this brings me to really the major purpose of today's announcement, which starts from a point of recognizing that one of the biggest concerns that we've heard from people is, I am having to do a lot of work to find vaccine appointments. And again, many of our vaccines are in healthcare providers who are calling their existing patients. But where we do have publicly available appointments, we wanted to create a technology-based partnership that would make it easier for Chicago residents to find publicly available appointments. And Zocdox is our partner on this. I'm going to turn it over to Richard Fine, the head of strategy at Zocdox, who's going to explain more about this really incredible partnership that's in place. Before I do that, let me again just set the reminder that this week, here in the city of Chicago, we are receiving 17,550 first doses of Pfizer, 22,400 first doses of Moderna. That means we're getting about 40,000 first doses this week across Chicago, meaning we can vaccinate about 5,700 Chicagoans every day. Reminder, there are more than 360,000 Chicagoans who are over 65, another 350,000 Chicagoans who are in the frontline essential worker group, not including the people the healthcare workers who are now raising their hand to get vaccinated. So vaccine supply remains very limited, which means appointments remain very limited. But you're going to hear about something we're really excited. As more vaccine becomes available, we'll be able to use this platform to make it easier for Chicagoans to access publicly available appointments. And with that, I'll welcome up Richard Fine.
Thank you, Dr. Allwoody, and very excited to be here. To just set a little context for this, if we think about all of the things that need to happen in order for the mass vaccinations to occur, many of these things are both very new and very challenging. We have got to obviously develop these vaccines on an accelerated timeline, the cold storage and cold chain, the building of these vaccination centers. All of this is a new challenge. But as Dr. Allwoody mentioned, one of the most visible and the kind of tip of the iceberg challenge that people are experiencing is being able to find where there are available appointments across the city of Chicago and across the country at large. And what this looks like is people spending hours checking different websites, making phone calls, in some cases walking in and trying to find where there might be a publicly available appointment. That experience is obviously frustrating for people, but it also tends to reward those with the most time and the most resources to be able to do that, and that maybe isn't the fairest way for us to do this. And I think from the Zocdox perspective, it doesn't have to be this way. This is a solved problem. In fact, at Zocdox, we've been solving this problem for 13 years, and I think many of my colleagues would say we unintentionally have built the company in order to be around for this moment. And what I'm going to walk you through is how we hope to be able to focus people on some of the other challenges that aren't solved challenges and leave the scheduling one aside. So to just quickly level set on what Zocdox is, as some people may not know, millions of patients every month come to Zocdox and they look for a provider. They enter their insurance, their need, and their location, and they see a set of providers near them in over 100 specialties, and they're able to instantly book an actual appointment. The secret sauce of Zocdox is the connections we've built in with all of the different scheduling systems that exist. So we have connections into all the to large health systems, as well as individual practitioners, dentists, whatever it might be. And we've built and maintained these connections so that a user, when they come, is presented with a list of who is available and is able to book that right then and there without any of the complexity of the systems getting in the way. And that is very much what we hope to be able to use when we talk about scheduling for vaccines as well. We've adapted our technology in order to look across the different systems and make it simple for a Chicagoan to go online and see where there is availability at different locations. We've worked nights and weekends to be able to do this, and we hope that as you go right now, you'll be able to see availability for some of these sites. I want to emphasize, as Dr. Woody has as well, availability is limited right now. As you go on, there will be times when there is nothing there. In that case, it's okay. You can come back and you can actually just put in your email and we can notify you when availability does become available. To just quickly touch on the partners here. The initial partners for this include the Amita Health System, the Rush Health System, the City Pods, the Erie Family Health Center, and Innovative Express Care. We will be continually adding new partners in this central site so that you people can go online and check and see availability there. It's also free for any provider who has availability to join and list it on the site. I'm just going to quickly walk you through the way the actual experience works in a video right now, and then I'll just walk. What you'll see is the first step is to select your state. So we want to make sure that the eligibility requirements are based on your state. In this case, the person selects Illinois. They then select their eligibility information, and providing they're eligible, they can then see available times and make an appointment right on Zocdox, and then actually book a visit right there. I've somewhat simplified the booking step, but it gives you a sense of how this works. If you go to Zocdox.com/vaccines, you will see this is available right now. Oops. Just to remind, so it's clear. First, select your state, then enter your eligibility information, then look and see the available times, and then you're able to book. I want to say that we've actually, as we look at this, people are booking in under a minute, and we're very proud of that. I think that's a tremendous improvement over the hours that people are spending and they're not able to find vaccine at this time. And I actually want to thank the City of Chicago, Dr. Woody, and others as well. They have been shown real leadership and speed here. They've been a model partnership for us. And I want to say on behalf of my colleagues at Zocdox that this is an honor to serve in this way. And we have done this at the only price we were willing to do it for, which is free. It is free for the City of Chicago, free for the patient, free for the provider. We will not be selling any data for this at all. And we stand ready to do the same for any county, city, state, or provider in the US who would like to do that. Thank you. And I'll hand back to Dr. Woody.
Muy buenas tardes. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago. Estamos celebrando hoy la venida de Zocdox, una forma centralizada de poder hacer sus appointments o poder hacer sus citas para recibir la vacuna. La ciudad de Chicago y Zocdox, ZOC, están anunciando una asociación en la que Zocdox servirá como la plataforma principal de la ciudad para que los habitantes de Chicago elegibles, de acuerdo a nuestra lista de priorización, encuentren y reserven sus vacunas para el COVID-19. El ZOC coordinará la disponibilidad de las citas en tiempo real. desde sitios selectos en Chicago, como las clínicas de dispensación masiva o de vacunación masiva, así como las organizaciones de atención locales, mediante la creación de un mercado central para ayudar a los habitantes de Chicago a encontrar esas citas y reservarlas más fácilmente. Sabemos que muchos han tenido problemas buscando sus citas médicas, que el primario ya tiene sus citas llenas, que el farmacéutico ya tiene sus citas llenas. Así que esta es una opción muy real, muy buena, y estamos celebrando. Chicago es la primera ciudad en implementar el programador de vacunas Zocdox para agilizar la programación de vacunas. Los habitantes de Chicago pueden visitar zocdox.com/vaccine o vacuna, en inglés vaccine, VACCI, donde confirmarán su ubicación y la elegibilidad de acuerdo a la lista de priorización. Si es elegible según nuestras listas de priorización, según las pautas aquí de Illinois, Zocdox mostrará las ubicaciones de las vacunas cercanas y la disponibilidad de las citas en tiempo real. Los pacientes podrán seleccionar fecha, hora y ubicación e instantáneamente reservar una cita en línea. Este servicio ofrece soporte de traducción para más de 100 idiomas, incluyendo el español. El servicio también tiene una variedad de herramientas de accesibilidad que los usuarios pueden habilitar si necesitan apoyo adicional. Aunque el suministro de vacunas es actualmente limitado, las citas se agregarán de forma continua a medida que se asignen más vacunas a los proveedores. Además, la ciudad y Zocdox esperan que más proveedores de atención médica locales, incluidos otros sistemas hospitalarios y centros de salud calificados a nivel federal, se unan a este importante esfuerzo de accesibilidad. Con este fin, la Asociación de Hospitales y Salud de Illinois alienta a sus miembros a participar. Se anima a los habitantes de Chicago a buscar primero una cita para la vacunación con sus proveedores de atención primaria, si tiene uno, y también a través de las farmacias locales o sus empleadores, si es que están disponibles ahí. Pero el programador de vacunas Zocdox servirá como un recurso público y gratuito para aquellos que de otro modo podrían tener dificultades para encontrar o tener acceso a la vacuna. Los proveedores de atención médica pueden integrar a esta nueva solución a su sistema de programación existente o pueden utilizar el calendario dedicado basado en el web de Zocdox para respaldar la programación en línea. Esta capacidad única se hace posible que Zocdox agregue y muestre forma centralizada de citas de vacunas disponibles a los usuarios en un tiempo real, a lo fáciles de encontrar y se puede reservar al instante en menos de un minuto. Además de su nuevo programador de vacunas, Zocdox lanzó recientemente un servicio de seguimiento de vacunas personalizado que distribuye la información necesaria a los consumidores y ayuda a proporcionar respuesta a preguntas comunes. Con el tiempo, este servicio se volverá más práctico, ayudará a los usuarios a desarrollar fácilmente un plan de vacunación, incluida la búsqueda en un lugar de vacunación cercano y la reserva de una cita en línea segura. Chicago continúa vacunando en la fase 1A del lanzamiento de la vacuna y ahora 1B, que son trabajadores de la salud y residentes y personal de atención de largo plazo. Y recientemente pasó las primeras etapas. Esto significa que los habitantes de Chicago mayores de 65 años y grupos específicos de empleados de primera línea esenciales de mayor riesgo son elegibles para la vacunación. Incluso es elegible, puede llevar semanas obtener una cita debido al suministro limitado. Pedimos paciencia. Sabemos lo difícil que es, pero estamos buscando esas soluciones de las vacunas, y la ciudad está recibiendo del gobierno federal más y más vacunas y así se estarán haciendo disponible al público. La vacuna se ofrece sin costo a los habitantes de Chicago que la deseen, pero necesitan paciencia mientras aumentan las cantidades. Gracias.
Thank you, Mr. Fine, Dr. Luna. Let me just underscore a couple of things and then I'll take questions. One is that vaccines available through Chicago providers are meant for people who live or work in the city of Chicago. We've certainly seen a lot of examples of people coming in to be vaccinated in Chicago, and if you work here, you are welcome to do that. But we would ask that people first seek vaccine in the county and the state where you live. So I just wanted to underscore that for starters. Secondly, I just wanted to emphasize how excited we are about a couple of points here. One is that, again, this is free. This has been free to the city of Chicago. We reached out to Zocdox to say we knew that they were the country's leader in terms of online healthcare scheduling, said, can we figure out a way to make this work for a problem that we're working to solve here and across the country? That there is no cost ever for getting a COVID-19 vaccine in the city of Chicago. There is no insurance requirement and there is no cost to Chicagoans. And the last thing is that, again, appointments are very limited. I know I've said it, but I can't say it enough. One reason we did not launch this earlier was because we have continued to be primarily vaccinating healthcare workers from 1A in our City of Chicago pods. And all appointments, even in our pods, will not be publicly available. Many continue to be allocated for our frontline essential workers, particularly ones who work in smaller employment settings. We also continue to direct vaccine to healthcare providers, to pharmacies, and to employers. But for publicly available vaccine, we're so excited to have a strong tech platform that as vaccine availability rolls up, can grow with us. So again, really pleased to be announcing this today and happy to take your questions.
Good afternoon, Dr. Arwady. I'm Natalie Perez with Univision Chicago. I have many questions here, but I'm going to start first with our questions. We are hearing about clinics offering vaccines to residents not on the priority list right now, presumably because they have people who don't show up and the dosage may go to waste otherwise. Your thoughts on this? And I have, if you have any issues, guidance on what to do with leftover dosage.
Sure. So let me just set a baseline here, and then we'll talk a little bit about how Zocdox and platforms fit in as well. So first of all, I do think people don't fully understand the concept of wasting vaccine. Moderna and Pfizer vaccines can sit in the freezer for 6 months, no problem. Once they come out of the freezer or the ultra cold, we have 5 days to use them in that refrigerated state. And then only when you puncture a vial, if it's Pfizer, there are 5 doses available in it. If it's Moderna, there are 10 doses available. You have 6 hours to use those doses. So typically where we sometimes see this happening near the end of the day, we are not talking about hundreds of doses. We're usually talking about, fewer than 10, typically fewer than 5 doses. And we have strongly asked all settings to make sure that they have a backup plan, basically, if they don't have people show up for appointments. And so, for example, at the City of Chicago pods, at the end of the day, we vaccinate the people who are working and volunteering in those pods. And pharmacies, particularly pharmacies based in grocery stores, given that grocery stores are on the priority 1B list, we would want them to be vaccinating those grocery store employees. But otherwise, maintaining a backup list is absolutely a best practice. And Zocdox, to get back to sort of the point of the question here, number one, you'll note that there was, you do need to say what is your eligibility. And we can't police if people are not being honest in terms of their eligibility. This has been a big conversation here in Chicago, and we've erred on the side of making this easier for people to be able to get vaccine, not setting a lot of barriers up, but also trusting that people will be honest in terms of not jumping the line. But also the ability to have people registered in Zocdox knowing, for example, their zip code of location will let us potentially access that list if vaccine appointments were to become available, for example. So there's a number of ways that we may be using it to avoid that. But there's not wastage of vaccine going on in Chicago. I want people to hear that strongly.
Another question. Biden administration to begin shipping vaccine doses directly to pharmacies. How will this impact the city vaccination efforts?
Sure. So City of Chicago has already been providing vaccine to many pharmacies. So about 9 to 10% of our vaccine has been given out already through pharmacies. So in addition to Walgreens and CVS, which are in that federal program, we've already here partnered with Walmart, we've partnered with Jewel Osco, we've partnered with Mariano's. So the new federal program is a way for pharmacies that perhaps have not done the local signing up to be a vaccine provider can more easily be able to access it. We're pleased about it, but it doesn't get us any more vaccine. It just gives us another route to be able to direct vaccine. So we are, again, really set up to be able to use pharmacies. We're already using them and just waiting for more vaccine to be available.
Okay, this question is from Alexandria Fisher from NBC. With the city now in phase 4, are there any plans or discussions about allowing some fans back into the stands for Blackhawks or Bull games?
So let's just take a slow look at this. We saw the data. We're definitely making good progress here, but we are still not even below that 400 case mark and that 5% positivity that really mark our danger zone here in Chicago. Where I think about fans in stands, that is months away, realistically. And certainly as we make progress, both on case counts, first and foremost, doing the things that we know work, as well as rolling out vaccine, I am certainly optimistic that we will be able to be reopening further, but we're going to have to be doing that in a way that's cautious, and I really can't predict months from now where we will be. I'm feeling optimistic based on the way things are going right now, but if I've learned nothing in more than a year of doing COVID, it's that it is right to look at the information that we have right now, make our decisions based on the information that we have now, and not try to predict many, many months into the future. So, things are all heading the right direction right now.
Another question from NBC. What is the race breakdown and who's getting vaccinated in Chicago? Last week you mentioned that 15% of vaccination were given to Black Chicagoans and 17% were Latino. What are the updates on that?
Yep, thanks for that question. And we did actually post that details online, but even in just 1 week. So as a reminder, when we announced those numbers, that was as we were coming out of phase 1A, meaning all of our vaccine had gone to healthcare workers and people living in long-term care facilities. With our move into 1B, with our launch of Protect Chicago Plus, with our ability to pull in many other providers and other locations for doing vaccine, just in 1 week we've seen Black Chicagoans 15% up to 19% of the allocated vaccine, Latinx Chicagoans from 17% up to 19.9, basically 20% of the allocated vaccine. In that setting, we've seen white drop from 53% to just under 50%. So still a long way to go from an equity perspective, no doubt about it, but I'm very pleased with the progress that we've already seen, and we continue to monitor those numbers closely and do a lot of work to push vaccine and lower barriers in settings where we really want it, that have been hardest hit by COVID and that we really want to make sure can most easily access vaccine.
This question is from Alice Jean. How many doses are you allocating vaccine every week to CPS, and what will that stockpile add up to mid-February when the district expect to be administering vaccine?
Sure. So I've gotten a number of questions. Obviously there's a lot of conversation about CPS right now, and one thing I will say is I think some of these exact numbers are still in some negotiation, and so I don't want to speak out in details about them. But what I can tell you is that we've worked to really assess the percentage of eligible Chicago residents that the CPS membership makes up, and we are definitely allocating, even over allocating vaccine to that group, recognizing how important it is to get Chicago back to school. So already there have been more than 3,700 CPS employees who have either been vaccinated or been given the opportunity to sign up for vaccine. And we will be directing a dedicated stream of vaccine weekly to the educators who work for CPS, just as we direct a dedicated stream to the educators who work for private and parochial schools and daycares, just as we direct a dedicated stream to the first responders, to the correctional officers, to the grocery stores, to everybody else in 1B. So that I would refer to the CPS plan for the details of some of that, but particularly while some of these negotiations are going on, I don't want to get premature about some of those details related to vaccine. But I do think we are in a good place there. Everybody, including CDPH, is in agreement that we want to get Chicago schools back in session, and we want to make sure that educators have access to vaccine. We just can't make that access at the expense of all of the other populations that really need to make sure that they can get vaccine as well.
This question is from Derek Hengel. It seems that not a hospital-attached private practice, healthcare workers are having problems getting the vaccine. How can healthcare workers get vaccinated when they cannot receive appointments via CDPH?
Okay, so a couple things on this. First is that as always, if you go to chi.gov/COVIDvax, there is a tab there specifically for healthcare providers that gives healthcare providers the information if they want to enroll to get vaccine, if they want to connect to Zocdox. There's multiple pieces here. But also, there is a survey that unaffiliated healthcare practices can fill out, and we've received thousands of them. In those surveys, the clinic tells us about whether this is a home health agency, whether this is a dental facility, whether this is a physical therapy facility. They tell us how many individuals work for their practice, and we work to get them connected to vaccine. We still are receiving thousands of people who need vaccine from 1A. And in some cases, those are people who maybe were not ready to raise their hand right away in the very first part of this rollout. We really want to get our healthcare workers vaccinated. So I would encourage anybody who has not sort of filled out that form. It's done at a practice level, so it's not an individual. But then also you'll note that within Zocdox, and maybe if you want to speak just a little bit to this, one of those eligible groups is for healthcare workers. So maybe just to add in how that would work with Zocdox.
The purpose of this is for patients and for providers to have a single location where availability is listed. So if you are a provider or practice or a smaller organization and you would like to have the vaccine doses that you have be listed within the Chicago system, please contact us. There's if you go to zocdox.com/vaccine/provider, you'll be able to see a page where you can register. It is entirely free to join. We'll build the connection for free to your system and enable you to take bookings from that central site. So please contact us. That will also enable the city site to be more complete and have more of the different locations that have vaccine doses.
Thank you. And just to add to that, one challenge that we've heard from smaller providers is if they don't have an appointment system in place. This was one of the things that where we were doing a lot of follow-up. There were people who were in some cases trying to schedule vaccines, using Excel spreadsheets and whatnot. This offers an opportunity on the provider side, as well as where there are individuals who need to be vaccinated.
Okay. This is from Crane's Chicago Business. Does the city have any plans to offer a vaccines hotline or make something accessible through 311 for those that don't have internet? Any other plans to link this service through local aldermen, community centers, churches?
Sure. So couple of answers to that. So first of all, when people call 311 or call the general hotlines, we're able to provide the information, but there's not additional vaccine availability through those hotlines compared to what's here. Our primary approach for people who are not connected digitally remains, again, first and foremost, through healthcare providers. They are getting vaccine, lots of vaccine right now, with the express purpose of calling their existing patients. This also helps to make sure that our vaccine is going to Chicago residents, people who get ongoing medical care in Chicago, and it really helps us, as you saw in this data from this last week, get to our older Chicagoans who in many cases may not be as connected to the internet. So that's one. And then secondly, as part of Protect Chicago Plus and other outreach efforts, this literally includes things like, are people going door to door helping people, can I make you a vaccine appointment? Can I get you registered? In a way that there are vaccine appointments dedicated for that community and pods that are set up specifically to make sure that some of the areas that we know are less digitally connected and otherwise may not otherwise get vaccine. And certainly there will be work through churches and other community-based organizations that has already begun. We're really excited about these efforts. I think it's one of the spaces that Chicago is really leading in nationally in terms of the way we're thinking about this and approaching it, and trying to think about a lot of different ways that people are able to access vaccine. Zocdox is an online platform. It is, we think, one of the easiest to use online platforms out there. It's one of the reasons we looked at it. But we want to make sure that even people who are not connected online are able to access vaccine and not having to sit on hold for hours on end either. And so those are some of the approaches we're using.
Okay, this question is from WGN. Can you mention that when we went on the site just now and all of February just got booked, or some we know in 1B were able to book for March?
Okay, so like I said, very limited vaccine appointments. And as we receive more vaccine, we'll be able to be making more appointments available. It doesn't surprise me at all that March appointments may be what is available because many appointments are already booked and filled with our frontline essential workers, et cetera. So again, I fully expect that, there are thousands of appointments available right now on this site, but I expect that they will probably be booked up probably really quickly. And as we get more vaccine doses in, if it's full, put in your email address and we'll be alerting you when appointments are available. But again, remember, Phase 1B does not mean most people get vaccinated that first week or this week. We've got more than 750,000 people who have just become eligible, and most people, are going to get vaccinated in March, for example. A lot will get done in February too. But, I would, that doesn't surprise me. Again, 5,700 vaccines available across the city.
Okay. And this is the last question from ABC. I think you already make a comment on this. What is being done or can be done to prioritize vaccinations in hard-hit communities for people who actually live there? We are hearing reports of people coming from outside those communities getting the vaccine.
Okay, so let me just take 1 minute to remind people about some of the Protect Chicago Plus, because I think this gets at the heart. It's one of the more, innovative things that's happening in Chicago. So as a reminder, our epidemiologists worked to pull together a lot of factors that put communities at higher risk for poor COVID outcomes or lower vaccine uptake. And so this includes everything from lower income to lower insurance rates to not having a primary care provider. It includes where in Chicago do we have a lot of these frontline essential workers that live. It includes epidemiological factors like where do we have a lot of people with high rates of chronic disease and over 65, and then it pulls in our Chicago COVID burden. Where have we seen a lot of cases, a lot of hospitalizations, and a lot of deaths? We pulled all of that together, and we pulled in crowded housing. You can look online if you want to see the details, but really looked at what has put communities at risk for COVID in Chicago, did a ranking, actually, 77 community areas, put all of this in, and then divided community areas into higher risk, medium risk, and lower risk in terms of COVID. And that has matched very well to the COVID vaccine uptake data that we've seen to date. So we've identified 15 community areas where we're starting. As a reminder, our Protect Chicago initiative has been going since the beginning of that second wave in October. And although it includes outreach across the city, at the heart of it, there have been volunteers, city security workers, safe passage workers, others, knocking on doors in our hardest hit neighborhoods, more than 400,000 doors over these last few months, making sure people have access to testing, to PPE, to other resources, if they need to isolate and quarantine, if they need assistance with food, whatever is needed to help best support those communities that are being hardest hit by COVID. Now, with the availability of the vaccine, of course, is at the heart of Protect Chicago. And so at the same time, while we work on things like Zocdox that make vaccine available, to people across the city, Protect Chicago Plus is our initiative to bring vaccine to those 15 community areas as a start. And to give a sense of what that looks like, first, our healthcare providers. Obviously, we've been enrolling healthcare providers all over the city, but people at the Chicago Department of Public Health have been reaching out to healthcare providers in some of the parts of the city that don't have as much healthcare access to make sure that we can support providers to become enrolled. And even if they're only getting 100 doses of COVID vaccine for their existing patients to start with, those are excellent. That's exactly the 100 doses. That's a very well-used 100 doses in terms of equity. And we're able to direct vaccine as long as those providers can use that vaccine every week. Providers who are in some of these hardest hit communities, whether they're hospitals, safety nets, federally qualified health centers, private providers, et cetera, will be able to get additional vaccine as much as they're able to use it. We also are targeting a lot of our strike team efforts to some of these hardest hit areas. So we are bringing vaccine. Obviously, we continue to work with our pharmacy partners to long-term cares, et cetera. But now that we're in 1B, remember, we're also focused on non-healthcare residential settings. So we're able to start bringing vaccine into low-income senior housing settings in some of these areas, into homeless shelters in some of these areas, into other settings where people are living together and where we've seen a high rate of COVID outbreaks. And then finally, this door-to-door work really involves pushing resources, working with trusted community partners. Each community has a 2-week planning process and then a launch. And so Belmont-Cragen is where we've kicked off, and there's been a lot of excitement related to what should this look like. Our goal is to pre-register people for vaccine, to have a lot of educational events, think about who are the people who are spokespeople, but then to literally do some registering and dedicate vaccine closed pods for people who live in those community areas. And so our goal is to make sure that we push vaccine to these community areas until they are at or above the city rate for COVID vaccine access. And so there's more to this strategy, and you'll certainly hear more. But I think the fact that we are also asking these communities what is driving COVID where you are, and being willing to say, in this case, if this is a particular type of employment that may be driving it here, or a risk factor that may go beyond the typical 1B accessibility. We are very open to that. Our goal is to get people vaccinated in these communities at a rate that can make sure that we're protecting Chicago, because getting vaccine into our hardest hit communities is the same thing as getting vaccine into the highest risk individual settings. Every vaccine there that helps stop the spread of COVID best protects the city against the variants that are emerging, the other ways in which we need to be prepared. So we make no apologies for over-directing vaccine. We think it is the right thing to do from an equity perspective and a necessary thing to do to get Chicago past COVID. So I'm thrilled about Protect Chicago, and I'm even more thrilled about the Protect Chicago Plus initiative.
Thank you so much, Doctor.
You're welcome. Thank you.